37.
No. I think it may have been knocked. I don't know if it's centered or not. So these are overpressure valves and two black ones. And we're about 2/3 of the way there.
Okay, Bruce.
Yep. If somebody wants to take over from Bruce, they can.
Start before you're tired.
And that should hold in there, Melissa, okay, if you had it stuck in. Occasionally the valve inside will get stuck, so when you take it out, you want to make sure that you pull it out and then you have to tap it to get the valve centered to stay pressurized, because you don't want this to go dropping down or it's hard in their ears again.
Go ahead.
We'll hear air hissing out of the two black ones in a few minutes, and that will indicate that it's at full extra atmosphere. So this will probably take them down, I would guess, to 2,000 feet.
We're down about 2,200 now.
Okay?
2,000.
And if anything, you can
Yeah,
overpressure.
it's yeah.
So you can overpressure a little, keep going, and it'll probably drop down maybe 1,800.
Yeah, I'm stepping into the class. Hang on a second.
What's he at now, Tom?
Looks quite over on that. It says 2,000. Let's see here. Almost down to 1,000.
Okay. We've done it at lower elevations where we've taken them down to 500 feet below sea level, which is sort of fun.
He's coming out.
So you can hear it hissing out, and you realize as he's breathing this, he's filling the bag up with carbon dioxide. So your option is either to continue pumping once every half minute or half minute to 2 minutes, or to use that bag to fill, and then he can eventually squeeze it when you repump, and then the bag will be connected to one of the black
It's
ports.
holding at 1,900 now, so
Okay.
when you pump it, it can go down a little further. When it equalizes, it stops.
So the person who's claustrophobic, they don't really care because they're so sick when you put them in there, it doesn't make any difference.
It would suck if you're claustrophobic.
At that point, you wouldn't even care. I've seen people who were just so sick they just didn't care. You trying to find one, you still can't find it? Oh, where did you find that? Dave? Your computer? So you know the computer better than I do, all right. Is this one you wanted? That's what I wanted, yeah, thank you.
So,
So how
what
often do
happens
you
if you
have
just-
to reintroduce
I
air?
reserved altitude
Did you?
last year.
Yeah, how often do you
On my
have to
computer?
reintroduce
I
air?
can't find it on yours, I can't find it on mine.
I don't know, you said every 30 seconds or
Especially
so.
in your imagination, like I realize that slideshow, that's, obviously I
Well,
did.
no, because they
plus the
reviewed
Yeah, yeah.
practice recommendations.
I do remember you doing that now. I don't know.
It's about today.
You're gonna pop this shit.
So let's let them out, and to do that, pull this out, it's not leaking, that's good. And if I push that real hard, so instead of doing that, I can just barely open it. Make root noises.
What's the pressure difference in your bag, you have to know?
Say again?
What's the pressure difference? This whole amount of pressure.
It's good for one extra atmosphere. And if you look at the book
You
in
know
there,
how to use your
Yeah.
slowly.
Okay.
Maybe like 6 or 10 or 12 pounds, there'll be some kind of pounds.
If you read it in that book, it'll probably tell you. I don't remember the poundage. I know that I've been able to, what elevation I'm able to drop to. And I know that it's certified for 1 atmosphere. What you need is at least 6 atmospheres for dive medicine. 6 to 20. And they make a 8 atmosphere bag that's, I think, $6,000.
And they've been in a long time for divers, right? Like how long normally?
Yeah,
Sort of
1 to
like-
3 days.
Yeah, and with this, how long would it normally be if you were like up at?
Well, if you got lots of friends, it might be a day, but normally you're gonna be 2 hours.
So Carl, on my last trip, I had a group, and the one of the individuals, as soon as we landed at the
Kathmandu?
No, we were in
Lukla?
Ladakh in northern India.
Okay.
So Leh was the entry point, which is 11,500 feet. Literally, as soon as we got off the plane,
She vomited?
she was headache, vomiting, horribly sick. For
Well-
like, and we had 3 rest days before we started. And
There's several aspects to it. One, did she take Diamox?
Diamox, I had her on, she had a plan for a whole year getting her physically fit because she's from sea level. And had them drinking lots and lots and lots of water
Some
before.
of it's in the mind, there's some psychogenic factor, there's a lot of physiological factors. Some people just aren't designed to go to altitude.
Did she pre-treat with Diamox? I mean,
And you all-
did she pre-medicate with
Well,
Diamox before she started going up?
The other one is how much?
I'm not sure she did it on the
So the
way from
usual
Delhi.
is 125 milligrams twice a day.
Mhm.
And all you really needed is like 3 or 4 days at some elevation
Mhm.
before you get to your first entry